This presentation is on palpation of the scapula and the clavicle and the first rib. The first rib is a short C, and it lies at an angle of about 20 degrees or 20 to 30 degrees. And if you pinch the thickest part of the upper trapezius muscle, where you can feel that if you were to continue, you would touch your fingers, your finger and your thumb together, what you do is you take your middle finger and you put it just below that, and that should put you right on the tubercle of the first rib. And the spring test that I do on the first rib is I lift it straight up. I spring it, I take up the slack and then spring it up towards the ceiling. You can also palpate the top of the first rib, bringing your thumb down through the trapezius. An elevated rib is actually pretty rare. Much more common is a rib that is either medially compressed or laterally distracted. And I show a beautiful technique that addresses either one of those presentations by doing a pure distraction to the rib. The first rib actually attaches underneath the clavicle, so you can hardly touch it beneath the clavicle. To palpate the clavicle, you can come on the manubrium and come into the sternal notch here, and then come on top of the clavicle, and you can follow it all the way out laterally, and then you should perceive where there is a bump when it articulates at the AC joint, and the acromion is that prominent bump. Okay? So in testing clavicular position, you can put your thumb on both sides on the lateral border, and then on the anterior aspect of the lateral border, and then you come to the medial aspect, you're palpating superiorly, and then you're palpating anteriorly. Okay? The spring tests on the clavicle are to capture it with the heel of your hand, take the slack up and spring it medially, and then do the reverse of that. Take up the slack, pushing it laterally, and then springing it. And then with your thumb, you can do an inferior spring, and you can also do that at the most medial aspect. And you can also do a superior spring coming underneath it. A little bit tricky, but it can be done. And oftentimes you'll find a common pattern, a common presentation is a compressed AC joint. And we have a video on treating that as well. So after you've done palpation and motion testing of the clavicle, and I think I showed inferior spring here and posterior spring on the medial aspect, then you come onto the acromion, and you take up the slack and you spring the acromion straight inferiorly, and then you spring it at a 45-degree diagonal. So you're pushing posterior and lateral. So I come and I just contact the entire shoulder mass, and I palpate the clavicle and make sure I'm right on that acromion, and then I spring it, take up the slack and spring it at a 45-degree angle. You can also use the thumbs and follow the acromion along the spine of the scapula and spring it inferiorly. And those are the two most important motion evaluations of the scapula, is inferior glide and then that oblique treatment. And we have a very nice self-treatment for people that have compressed AC joints. And most people have good lateral mobility and good medial mobility, but you could have the person in sideline or prone, and you could spring medially and you could spring laterally as well. And you can also, coming back to the first rib, you can also come and have them reach across the body so that they bring the scapula out of the way. And you can come underneath that first rib and you spring at a 45-degree angle. And one of those vectors is a superior vector. It's an extremely rare presentation when someone has an inferior fixation of the first rib. I had one for decades, and it contributed to significant cervicogenic headaches. And when I discovered myself that it was elevated and it did not have any inferior spring, and it was positioned lower on the right side, and also underneath there was no lift at a 45-degree angle, I treated it by reaching across with my left hand, and I captured underneath that rib, and then I just pushed down on my forearm, my hand being rigid, so that it would do a vertical force onto that rib. And I did that for 5 minutes, and it was profound, remarkable pain relief. So anyway, I think this adequately covers the palpation and the springing of the clavicle, scapula, and first rib. Thank you.